following video outlines our exercise programme for our patient Sarah and details our interventions. Our first intervention is to improve cardiovascular conditioning and gait pattern. The purpose of our treadmill training is to have a controlled environment in which to improve both gait pattern and cardiovascular conditioning. We're aiming to improve Sarah's score on the MS Walking Scale, a 12-item subjective report on the quality of ambulation. Sarah has a good baseline fitness, so is able to jog. Her target is to be able to jog half a mile at 5.2 miles per hour, while the PTA monitors her heart rate and breathing pattern. We'll also be monitoring for equal bilateral weight bearing and step length, as due to her weakened muscles on the left lower extremity, there's a decrease in step length. The PTA will also provide verbal cues for diaphragmatic breathing to reduce use of accessory muscles, to keep hands and shoulders relaxed and in neutral, to raise her knees for good foot clearance and maintaining pelvic stability. Exercise 2 is a D2 upper extremity flexion pattern with a 2-pound weight. The aim of this is to maintain and increase strength and coordination in Sarah's left upper extremity. The pattern mimics movements in her ballet choreography and is essential in functional ADLs. Sarah will perform 3 sets of 8 reps. She's able to receive extrinsic feedback both from the mirror and the PTA, who will be monitoring the correct movement pattern and observing for any compensation strategies. Exercise 3 is a single leg stance on an AirX pad in parallel bars for safety. Our aim is for Sarah to improve her Berg balance score from 48 to 56. Whilst this is already a score which indicates independence, stability is one of Sarah's own goals. The PTA will be on standby assist, giving both tactile and verbal cues for posture and glute activation, as well as using ankle, hip and stepping strategies for balance. Maintaining and improving balance and stability will maximise safety and will assist Sarah in prolonging her career as long as possible. Exercise 4 is tandem standing. Again, we'll work in the parallel bars for safety. The PTA will be on standby assist, giving verbal and tactile cues where necessary to maintain posture and to use ankle and hip strategies. This activity also engages proprioception and the vestibular system. We can challenge these systems more by progressing to eyes closed and tandem standing on an uneven surface. The PTA can safely progress standing balance by applying perturbations in all directions. Sarah will be doing 3 times 30 seconds to work on her Berg balance scale. Our final exercise is single leg clocks with crossing the midline. Sarah will be doing 3 times 15 with emphasis on her left leg to improve strength, balance and stability. This activity also mimics the ballet choreography that she uses. The PTA will be on contact guard assist as necessary, making sure the patient is crossing the midline, keeping a neutral spine and focusing on hip extension. With Sarah's consent, her fiancé and parents are invited to attend any or all of her PT sessions in order to observe her progress, to learn the exercises and to discuss home exercise programs. Conservation of energy and monitoring fatigue levels are essential components in the life of people with multiple sclerosis. We would discuss with both Sarah and her family when they feel is the most appropriate time of day to be carrying out her therapy, to ensure still that she has the energy needed for other activities. The family can keep a journal to note her reactions to various activities and stimuli and to establish the optimum schedule for them and her PT treatment.